Good morning, Alex and friends. I'm Grace. Today is Thursday, September 19th, 2024, and you're listening to Alex's News. The high in Riverside today will reach 78.5 degrees, with a low of 63.0, making for a pleasant autumn day. Coming up on Alex's News, we'll explore the reasons behind the House's decision to reject a bill aimed at preventing a government shutdown. We'll also look at California's efforts to tackle rising healthcare costs and what measures the state is considering. Plus, we'll delve into how newly discovered black hole jets are pushing the boundaries of our knowledge about the early universe. Stay tuned for these stories and more. We begin with a developing story from Capitol Hill. The House of Representatives has rejected a temporary funding bill aimed at averting a government shutdown. For more on this, we turn to our congressional correspondent, Ethan. Ethan, what can you tell us about this vote?
Grace, yesterday, on September 18, 2024, the House voted down a temporary funding bill proposed by Speaker Mike Johnson. The final tally was 220 to 202, with 14 Republicans joining nearly all Democrats in opposition.
What was in this bill that caused such widespread opposition?
Well, the bill would have funded federal agencies at current levels through March 28, 2025, which is about 191 days from now. However, the main point of contention was the inclusion of the SAVE Act, which would require proof of citizenship for voter registration in federal elections.
That sounds like a controversial addition. How did lawmakers react to this provision?
You're right, Grace. Democrats and some Republicans argued that this requirement could potentially disenfranchise many Americans who don't have readily available proof of citizenship. It's worth noting that, according to reporting from the Los Angeles Times, Republican presidential nominee Donald Trump had actually encouraged House Republicans to reject any continuing resolution that didn't include the SAVE Act.
Interesting. Now, Ethan, with this bill rejected, what's the path forward to avoid a government shutdown?
That's the big question, Grace. Speaker Johnson has indicated he'll pursue an alternative plan, but he hasn't provided specific details yet. Meanwhile, Senate Majority Leader Chuck Schumer is calling for a bipartisan approach. He's suggested a clean continuing resolution to fund the government until December, which would allow time for negotiations on a full-year spending bill.
And how much time do they have to figure this out?
Not much, I'm afraid. The new budget year begins on October 1st, which is just 12 days from now. If lawmakers can't approve a stopgap measure by then, we're looking at a partial government shutdown.
That sounds serious. What would be the consequences of a shutdown?
A shutdown could have significant impacts, Grace. We could see furloughs for non-essential federal employees, delayed pay for essential workers, and disruption of some government services. There could also be economic consequences. As ABC News has uncovered, a shutdown could lead to a decrease in GDP growth and reduced consumer spending.
Given these potential consequences, Ethan, is there any movement towards a compromise?
There's definitely pressure to find a solution, Grace. Senate Republican leader Mitch McConnell has emphasized the need to avoid a shutdown, especially before the election. He's warned it could be politically disastrous for Republicans. However, some conservative Republicans are pushing for a 6-month funding extension, hoping that a potential Trump victory in the upcoming election would give them more leverage in budget negotiations.
Thank you, Ethan, for that comprehensive update. We'll be sure to keep our viewers informed as this story develops.
You're welcome, Grace. I'll be keeping a close eye on Capitol Hill, and will report back with any new developments.
Thanks again, Ethan, and viewers, stay tuned as we continue to follow this critical story. We turn now to a significant development in California's healthcare system. The state has implemented what's being called the nation's most aggressive cap on healthcare cost increases. Joining us to discuss this is our healthcare correspondent, Chloe. Chloe, can you give us an overview of this new measure?
Certainly, Grace. According to reporting from CalMatters, California has set a cap aimed at limiting annual healthcare spending growth to 3% by 2029. This measure has been established by the Office of Healthcare Affordability, or OHCA, and it's designed to address the high healthcare costs in California, which currently ranks as the third highest in the nation.
That's quite ambitious. How will this cap be implemented?
The cap will be phased in over 5 years. It starts at 3.5% in 2025 and 2026, then decreases to 3.2% in 2027 and 2028, before finally reaching 3% in 2029 and beyond. This gradual approach is intended to give the healthcare industry time to adjust.
And who exactly does this cap apply to?
The cap applies broadly to hospitals, doctors, and insurers, essentially constraining their annual spending increases across the board.
How does OHCA plan to enforce this cap?
OHCA has several enforcement measures at its disposal. These include requiring non-compliant entities to explain their actions at public meetings, implementing performance improvement plans, and assessing administrative penalties starting from 2026. Additionally, as AM 870 The Answer reports, OHCA will begin collecting data on total healthcare expenditures from payers beginning September 1, 2024, which is 348 days from now.
How does California's approach compare to other states?
California is joining 8 other states that have implemented similar cost growth targets. However, what sets California apart is its enforcement mechanism with fines. For instance, Massachusetts has a similar cost control target but hasn't effectively penalized healthcare providers for exceeding limits.
Has there been any opposition to this measure?
Yes, there has. The state's hospital and doctors' lobbies oppose the cap, arguing that it's unreasonable given recent inflation spikes. There are also concerns about potential impacts on service quality and access to care.
What about the potential impact on consumers?
While the cap doesn't immediately reduce existing bills, it aims to limit future increases by constraining industry spending. Research suggests up to 30% of health spending is wasted on overtreatment and administrative inefficiencies, which this cap aims to address. The goal is to make healthcare more affordable for Californians in the long run.
Have similar measures in other states shown promising results?
The results have been mixed. States like Montana, Oregon, and Rhode Island have reported significant savings through their pricing strategies. However, some states have exceeded their spending caps due to factors like high inflation and labor demands. There are also concerns about potential adverse impacts on access to care and hospital financial viability.
It sounds like a complex issue. Are there any safeguards in place to prevent unintended consequences?
Experts emphasize the need for careful policy design. Measures such as phasing in regulatory constraints, monitoring impacts on quality and provider financial condition, and tying caps to cost inflation measures can help achieve desired outcomes without compromising patient care. California's implementation will be closely watched in the coming years to assess its impact on both affordability and quality of care.
Thank you, Chloe, for that comprehensive overview of California's new healthcare cost cap. We'll certainly be following this story as it develops.
You're welcome, Grace. It's definitely a significant development in California's healthcare landscape.
Here are some other headlines. The new Democratic Party in Canada has terminated its confidence and supply agreement with the Liberal government, citing failure to address corporate greed and weakness in standing up for ordinary Canadians. This move puts Prime Minister Justin Trudeau's minority government at risk of falling. Meta Platforms has banned Russian state media from all its platforms globally, including Facebook, Instagram, WhatsApp, and Threads. The ban comes in response to alleged foreign interference activities and follows recent U.S. sanctions targeting Russian media outlets. At least 30 people have been killed in shootouts between rival factions of the Sinaloa cartel in Mexico. The violence, centered in Culiacán, has led to school closures and the deployment of over 2,000 security forces to the region. Glasgow has been selected to host the 2026 Commonwealth Games. Following Victoria, Australia's withdrawal, the event will be scaled down to 10 sports across 4 venues, with significant financial support from the Commonwealth Games Federation and the Australian Commonwealth Games Association. A Turkish drone strike in Iraq's Kurdistan region has killed 3 people, including a child. The attack, near the village of Harmela, targeted a pickup truck and is part of Turkey's ongoing military operations against the Kurdistan Workers' Party in northern Iraq. We're continuing our coverage of recent scientific discoveries. Our next story takes us to the far reaches of space, where scientists have made an extraordinary finding. Joining us now is our science correspondent, Ethan. Ethan, what can you tell us about this cosmic breakthrough?
Well, Grace, scientists have just announced the discovery of the longest known pair of jets streaming from a supermassive black hole in a distant galaxy. This finding was reported yesterday in the prestigious journal Nature, and it's causing quite a stir in the astronomical community.
That sounds fascinating, Ethan. Can you give us an idea of just how long these jets are?
Certainly, Grace. According to the report, these jets stretch an astonishing 23 million light-years in length. To put that into perspective, it's like lining up 140 Milky Way galaxies end to end. This discovery surpasses the previous record by about 7 million light-years.
That's truly mind-boggling, Ethan. How were scientists able to observe something so vast?
Great question, Grace. The discovery was made using images from Europe's LOFAR radio telescope. LOFAR stands for low-frequency ARray, and it's an innovative radio interferometer designed to operate in the low-frequency range. It consists of a network of simple dipole antennas distributed across northern Europe, allowing for incredibly detailed observations of distant cosmic phenomena.
Interesting. What makes this discovery particularly significant for our understanding of the universe?
Well, Grace, according to reporting from ABC News, these jets date back to a time when the universe was less than half its current age. This was unexpected and provides valuable insights into the early universe and the role of supermassive black holes in its evolution. Marchen Hue, from the California Institute of Technology, one of the experts involved in the study, emphasized the extraordinary size of these jets and their potential to provide new information about the early cosmos.
That's fascinating, Ethan. Can you tell us more about what these jets are made of?
Certainly, Grace. The jets consist of superheated plasma expelled from the black hole. They're incredibly high energy and can sometimes disintegrate due to cosmic turbulence or lack of fresh matter to sustain them. However, jets from supermassive black holes can achieve enormous sizes, as we've seen with this discovery.
And how confident are scientists in their measurements of these jets?
According to the Associated Press, scientists are very confident in their measurement of the 23 million light-year length. Despite potential distortions over vast cosmic distances, they used multiple observational methods and verification steps, including machine learning, manual checks by astronomers, and even collaboration with citizen scientists to ensure accuracy.
That's impressive, Ethan. Lastly, what implications does this discovery have for our understanding of galaxy formation and evolution?
Great question, Grace. As reported by Stars and Stripes, supermassive black hole jets can have significant impacts on galaxy formation and evolution. They can influence star formation rates, regulate galaxy growth, affect the intergalactic medium, and play a role in the coevolution of galaxies and their central black holes. Eileen Meyer, a black hole researcher at the University of Maryland, Baltimore County, highlighted that this discovery opens up new avenues for research into the role of supermassive black holes in shaping the cosmos.
Thank you, Ethan, for bringing us up to speed on this groundbreaking discovery. It's truly amazing what we're learning about our universe.
It's my pleasure, Grace. The cosmos never ceases to amaze us.
Indeed it doesn't. Thanks again, Ethan. And that concludes our third and final story for this segment. That's all we have for now. Today's episode was made by Alexander King, with Claude Sonnet 3.5, the Perplexity API, and the Google Cloud Text-to-Speech API. Hope you have a great day. I'll see you tomorrow, Alex.